Hi, I'm Ed Highland, and this is HIMSS14 TV. We are coming to you from the highly anticipated event of this particular conference here in Orlando, Florida, and that, of course, is the address from former Secretary of State Hillary Clinton. Joining me now is Benjamin Harris, who's with Health IT News. And Benjamin, first, give us an idea. You were in the Twitter sphere, as well as listening in on what she had to say. How would you kind of sum up the conference and kind of the mood, if you will, that she was presenting?
Well, one of the big takeaways I got from Clinton's speech is she talked a lot about the need for bipartisanship in the push for health IT. And I thought that was really interesting. Earlier, I was at a session with the past and present heads of the ONC, and the first director of the ONC actually spoke at length about how he worked to quell a political fight when he was working under Bush. That Kerry's health IT director was able to work behind the scenes and avert a policy fight during the election. And he got a lot of flack from it. So I think that that's really interesting that a lot of people in this industry are talking about how health IT needs to be completely separated from policy. Clinton said in her speech, no matter what your political beliefs are, no matter what your partisan beliefs are, they need to be left at the door, and you need to focus on health IT as a goal. It should be policy-based, not politically based.
It seemed to be a challenge to the HIMSS membership, in my view, that they were trying to see if she could incorporate ideas from the technical experts in the HIMSS audience to not throw out the Affordable Care Act, but to improve it, to change it.
Well, yeah, I mean, she started off her keynote saying, it's funny that I'm up on stage and you're down in the audience and in the overflow rooms because you're the people working every day, all day, to change and develop health IT. And I think that it's really interesting and important that she noted that the Affordable Care Act and high tech and all of these industries are really new. I mean, you know, today we talked about the 10 years of health IT since Bush introduced it in his State of the Union speech. So she obviously recognizes that this is an evolving industry and that the people here at the HIMSS conference are the people who are working to shape a very nascent industry.
And you were the new media person for healthcare IT. Give us an idea of what the Twitter sphere was talking about during the course of the presentation.
This whole conference has been probably our most active on social media ever, so it was very exciting to see what people were saying about Hillary. Obviously, she's very good at speaking in ways that we can condense to 140 characters, which is great. A lot of people were really tweeting about how impressed they were that regardless of where you stand with her politically, that she was bringing a massive amount of experience from her decades of service. So there were a lot of people thanking Hillary for speaking so candidly about health IT and talking about it purely from her involvement with it since she was a senator.
Benjamin Harris, thank you so much for joining us and giving us that great insight. There are so many people, as you can see, coming from this capacity crowd here at the Orange County Convention Center. We wanted to get an idea of what they had to say. I'm going to toss it over to our Carrie Farinack, who will talk to some of the attendees.
Hillary Rodham Clinton has made such an impact on healthcare in the United States. Attendees here at HIMSS14 were eager to hear what she had to say.
She supports what we all support here at HIMSS, in that health information technology represents the infrastructure that we need to build upon to move forward in healthcare, whether it's care delivery, safety, research, education, and all of the good things that we want to do in moving forward with healthcare in this country.
Her history with healthcare, involvement goals, and even just how knowledgeable she was of healthcare. You think of her with being the Secretary of State, that everything would deal with either politics or war, but she actually is very knowledgeable about the healthcare initiative as far as health information records being protected and accessible at the same time.
I thought it was interesting to, when she talked about the comparison to other countries, right, what she's seen and how she's been trying to both bring what the U.S. has and to those countries and also learn from those.
I think she has a lot of great things to say. You know, I'm a registered Republican, and I think that I still like to listen to what she says and her views on healthcare, her views on the world, her views on what should be happening in Washington, D.C. right now, I think are relevant and pertinent to where we are.
I've been in healthcare for a long time, so I knew what she was doing in the 90s. You know, and really how she has worked very, very hard behind the scenes to try to make the changes that need to be made in healthcare. So I have a tremendous amount of respect for her and thoroughly enjoyed what she had to say.
No doubt Hillary Clinton's presentation will be one of the lasting highlights of HIMSS14. I'm Carrie Farinack for HIMSS14 TV. Ed, back to you.
Thanks, Carrie. Past and present national coordinators for health information technology join forces for a look at the next decade of health information technology. Featured speakers covered past and present strides in the industry while deliberating IT policy for the future. Incoming national coordinator Dr. Karen DeSalvo said there are some valuable key points to be garnered from the conversation, which have a direct impact on all aspects of healthcare.
There is a fair amount of consensus, not just in this room, but from what I've heard from everybody engaged in HIT, that this is a great time for us to look ahead after we've adopted to start to make systems more usable, to figure out what is the sustainable business case for this. And I'm not meaning just about how you pay for care, but how do we make sure that we can get consumers engaged, get their data in there, let them get it back out so they can become empowered to manage themselves, and then yes, focus on the healthcare piece, lower cost, improve quality, but begin to really think about improving the health of our nation and how important IT is going to be, health IT as a lever for that.
Attendees were encouraged to participate in a poll conducted on the HIMSS mobile app, which generated further panel debate followed by a question and answer session powered by Twitter. The response from members of the audience was overwhelmingly positive.
All of the leadership perspectives were very relevant, and so pulling them together into this panel was synergistic.
The personalities were very distinct. The points of view spanning two administrations, Republican and Democrat, the sense that clinical intelligence is not partisan. So they agree on so much more than they might disagree on. So that's a takeaway. And a lot of excitement.
And so meetings like this end up being a great forum where the various groups can get together to help drive the agenda to the future.
We are wrapping up another successful HIMSS Annual Conference here in Orlando, Florida. Education was a main focus, with more than 300 education sessions taking place, many of which featured live polling and interactive opportunities. There have been all kinds of new experiences here at HIMSS14.
We also launched some new opportunities on our exhibition floor, focusing on, for example, consumer engagement. So we launched our Connected Patient Learning Gallery, which was a way for our attendees to get their hands-on and touch and feel and ask a lot of questions about how to engage patients in their care. Because at the end of the day, we are all at some point going to be patients in this health system.
All in all, there were more than 1,200 booths on the show floor this year. In fact, if you stack them end to end, they would be taller than the Sears Tower. Every day, we've been bringing you the highlights from the HIMSS14 conference, but we wanted to give attendees the chance to share their personal highlights with you.
Oh, this year I really appreciated the work you've done in the interoperability showcase, especially the way you've repackaged it to make it more meaningful to the clinician and the physician so they can really see the value of interoperability in their care processes.
I like coming to HIMSS because I've learned a lot about the new technology and what's offered out there, and some of the new companies that are first-time vendors, it's nice to see them here too.
There's so many vendors here and contractors and subject matter experts on meaningful use, which is the one thing that I'm really interested in seeing, and just seeing what the new vendors have available as far as technology and advancement. It's awesome.
Well, that does it for HIMSS14 TV. It's been an amazing week, full of information, education, and most of all, getting a chance to better know your health IT colleagues. We're looking forward to seeing you at HIMSS15 in Chicago, April 12th through the 16th, 2015. You can find all the information you need at HIMSSconference.org. We leave you now with some of the incredible sights and sounds from HIMSS14. For all of us at HIMSS14 TV, I'm Ed Hyland. Thanks for watching. We'll see you next year.